Good afternoon and welcome to today's edition of Eurofound Live. Today we're going to be talking about one of the most pertinent topics on the EU policy agenda, care. Care, which includes childcare, longer-term care of older people, those with disabilities, and it touches on those who work in the care sector, those who receive the care sector, and in fact, the working conditions and the elements and issues arising from care. Care has been on the European policy agenda for some time, as we are all aware, and the improving of access to and the quality of affordable care has been one of the main goals. The European Pillar of Social Rights had put a strong focus on care. We had the European Child Guarantee. We had a Council recommendation on high quality early childhood education and care systems, a work-life balance new directive, which was in 2019. And this is all culminated in the European Commission presenting a European care strategy in September of this year. So we're delighted today to be able to really assess this care strategy and look at how we can make it fully functional, how we can make it work for the care sector, for those receiving care, and for those who are implementing care across the member states. I would like to welcome all of you who are joining us for this good and timely and pertinent discussion today. As always, you can follow us on social media, you can follow our hashtags, and you can follow us in the chat. We're looking forward to hearing from you. We're looking forward to receiving your questions, your queries, your comments on the discussion, and do that over the next hour as we launch into a conversation on the new European Care Strategy. So today, to discuss this with me, I am delighted to be joined by our own in-house resident expert, who is Hans Dubois. Hans is a senior research manager here at Eurofound, and he has been working on care for many years now. Welcome, Hans. We also have Stesi Igamenos, who's the executive director of Eurocarers. Eurocarers is an organisation which brings together carers organisations and other bodies, and they act as a voice also for informal carers across the European Union. And then we have, you're very welcome also, Stesi. And then we have Philippe Leroy, who's the policy manager on social protection at the Age Platform Europe network, which is a group of non-profit organisations who are the voice really for older people across the issues related to care and other issues across the European Union. What I would like to say here is that while we are aware that the participants and contributors today are largely focused on the long-term care aspect of the older care recipients, if you like, and the issues related to that, childcare and the other aspects of care are going to be responded to by Hans, who is our expert in these particular areas. But we've focused on this today for the reason that really at a European level, this is one of the first times where long-term care has really been discussed in this context and with this perspective. So as we start off today, I would like to turn to Hans initially, and maybe Hans, if you could just kick off the discussion with an overview within the context of today's environment, the problems that we are trying to address here, the issues that we are tackling, and how does the new care strategy respond to them, Hans?
Yes, hello. So first of all, I would like to emphasize that it's really great that we have a European care strategy. It focuses on childcare and long-term care. For childcare, of course, we had 20 years ago, the Barcelona targets were set with proportions of children who needed to be in childcare, but there was very little more. And this care strategy, for instance, now does also say something about the hours children would ideally be in childcare, and also to try to reach children at risk of poverty and social exclusion. and also acknowledging that the last is very important for the development of these children. With regard to long-term care, there was basically nothing done at the European level. If anything, it was mentioned in the aging reports from the European Commission in terms of increasing expenditure with aging societies. And now this care strategy goes as far as mentioning the social investment dimension of it. Now, why is this important? It's important for people with care needs, obviously, that they have access to good quality care, as the care strategy calls for. It is also important, though, for people without care needs at the moment, because people close to them may have them, but also they may need them in the future themselves. So we did research on social insecurities, and to be able to rely on care whenever you need it, it's really an important thing for mental well-being of people. Now, it is also important for the care providers that this strategy is there. These are, on the one hand, the informal carers, particularly important. So the strategy, for instance, says that there should be more support for them. I'm sure Stacey will say more about it later. It's also important for the formal carers. So there has been an incredible expansion of formal care workforce from over, so the social care, so that is 70% long-term care, 30% mostly childcare, has expanded in just 1 decade from 7 million to 9 million. And the increase has been most rapidly for long-term care. And at the same time, the workforce is also aging dramatically. Yeah. Now, lastly, it is also key for addressing gender inequalities. Because amidst this incredible change of the long-term care workforce, its growth, its aging, one factor has been totally stable, and it was the same for childcare, where the proportions of women employed are even higher, but that has remained the same in the past decade. So it's important in addressing gender inequalities because the workforce, the formal workforce, is highly female, even more so in some subsectors like domestic care, where the household is the employer. Then, so firstly, formal carers, that's the important gender dimension, that they are mostly female. Then informal carers, they're also for the majority female, and that's, of course, key for their quality of life and for their economic participation. Many of them are economically inactive or work part-time because of these care activities. And then lastly, and that's the case for long-term care, that also the recipients are more often female than male because of the higher life expectancy among women. So, however, I think as a final comment, you can address these, so anything you do in the area of care has a gender dimension, affects gender. It's good for women, basically. However, if you really want to address the gender inequalities, you have to address the segregation of women in long-term care and informal care. So this concentration, that's done by addressing stereotypes, gender stereotypes in society on a much deeper level.
Well, I think to address one particular stereotype is that I am the only woman on this panel dealing with 3 men talking about a very gender segregated sector and a very gender segregated topic. So I think we need to put that on the table for starters, and we'll certainly come back to the gender dimension, which is critical to how this care strategy will actually roll out over the next period. But Stacey, if I can take up another point that Hans just raised there about the formal and informal care aspect. And it's been some time that we've been trying to address, if you like, the challenge of the tension between these two and the different issues that are raised by these two elements and very important and growing elements of this sector. Can you talk us through a little bit what you think you see or how you see the care strategy responding to these needs?
Sure. Thank you, Mary, and good afternoon, everyone. Well, from our perspective, first of all, and I will focus, I'm afraid, primarily on long-term care. I'm sorry for that. The tension for us primarily lies in the fact that currently the majority of all long-term care in Europe is actually provided by informal carers. So family members, but not only, friends and neighbors as well, particularly in rural areas. And so many member states tend to over-rely on the participation of informal carers for the provision of long-term care, as if informal carers were just a free workforce or an invisible workforce, and that needs to change. The problem is even more complex because, first of all, a majority of informal carers, when they are not adequately supported, face a long list of challenges. Hans briefly mentioned access to employment, and particularly for women, of course. But it does not stop there in terms of social exclusion, risk of poverty, health, physical and mental health issues. So it is really a vicious circle. So I suppose the easy answer, based on what I just said, would be to say, okay, let's try and replace informal carers by professional, care workers. But unfortunately, we also have got a lot of convincing data emerging from the institutions, and not only showing that it is virtually impossible, economically speaking, to replace informal care by professional care altogether. So we will need to maintain somehow a proportion of informal care in the care mix in the future. So the question therefore lies in what is an adequate mix. In what proportion do we need professional and informal care? And how do we ensure choice as well? Choice for not only care recipients, but for informal carers to be or not a carer, and to what extent you want to be involved in caregiving. Now, from our perspective, I completely agree with Hans. We very much welcome the EU care strategy. We've been pushing for such an initiative at EU level for, I think, more than 15 years now. And there are many reasons why we believe that the strategy ticks the right boxes. I'm not going to be able to name all of them this afternoon. I'll just name a couple. The first one is, for the first time, the strategy explicitly acknowledges that formal and informal care are essentially two sides of the same coin. And so they are not mutually exclusive forms of care, but we need to support both of them. The Commission actually goes further by saying that formal care should obviously be the foundation of universal access to care, and then informal care should supplement that, not the other way around. We completely agree with that. And then the second key important response, which is included in the strategy or in the package, is that the Commission calls on member states to develop clear identification mechanisms and support mechanisms targeted at informal carers, in the form of access to information, access to training, access to respite care. And again, we completely agree, and that's a historic move, quite frankly, for our movement. So we are pretty pleased with the strategy, and we hope that the strategy will be endorsed by member states at the next EPSCO Council in December.
Well, that's a good place to move on to Philippe, because that's exactly what is at the core here, is that it may be that all of these elements are good in principle, but it is the implementation and the rollout that will count in terms of the benefits that we will see from the care strategy. So maybe can you talk us through a little bit from a longer term care perspective? I mean, what do you think are the issues that we might encounter, or have we already seen the kind of best practice that could see at member state level the implementation that would ensure that we see good quality, accessible long-term care for those who need it most?
Well, thank you. I would like to start with a point, an observation, which is that pretty much everyone agrees that the system of long-term care is having cracks all over it, and it's just bound together by how things are and by the necessity to have a long-term care system in place. But clearly, it doesn't suit the professional carers who have a high turnover, who are not seeing care professions as an aspiring profession, a profession to aspire to, not for residents who are sometimes facing neglect, sometimes facing restraints, sometimes not wanting to complain, but don't really see quality of life beyond the day-to-day sort of biological needs which are met by care. Nor by care institutions who have to face the staff turnover, who have to manage with very tight resources, nor for public authorities who see mainly this as a cost issue, nor for informal carers with all the issues faced by that Stacey pointed out. It's true that it's very gendered, that quite typical pathway, for example, would be a woman who has taken care of her spouse while he was still in need for care at home, who then passed away. Then this woman may be faced with social isolation, loneliness, and very often, actually, this is the point where there's also a cognitive decline or a physical health decline, which then brings that woman into more institutional settings. So institutional settings are settings where there are many more female persons in need for care. So how to tackle all this? A great thing about the care strategy is that it first asks the question and has the right analysis. It has the analysis in place that no one is really happy about care systems. That obviously they are very different. Some are very institutionalized. Others are much more going towards home-based care. Others are relying much more on informal care. So we're in very different places. But it is an opportunity to create a shared vision of what care is for. So not only care as services that support people in functional things that they're no longer able to do, such as cooking, eating, cleaning, etc., but as a service that is founded in a right to autonomy, a right to independence, and a very basic human aspiration to continue to participate, to be part of society, to have a sense of purpose. And so having the care strategy gives the chance to put that vision into the center of care policies. Very often they're centered on catering for the biological needs, keeping it more or less fundable for public authorities, and more or less by false facility grouping pathologies together or people who with the same needs together, and thereby removing them from society. So we should turn that around, and this is really a chance to rethink things. Now, this is very inspirational what I'm saying, and it's definitely not in the text when you look at it, because the text is very free in a certain way. It has a very inspirational language, but it's up to member states really to take the opportunity and to say, well, now that we have to draw up national action plans on care, now that we have to nominate care coordinators and do regular reports on EU level, now is the chance to actually have a conversation about how do we get there to this new model, particularly after the experiences of COVID, and particularly as a couple of scandals erupted around long-term care in the past 1 or 2 years in several member states. So this is a chance to rethink and to put resources together and to find practices which sometimes are very local, not necessarily depend on the larger system. Obviously, the larger system can encourage or discourage certain good practices, but it's very much about how the human interaction between the carer, or the person in need of care, and the different carers, the different services, because they are not all linked up. The informal carer, the family is working, and this is really the sort of the place where we need to change mindsets and give space to carers to actually properly do their job. Yeah, I will maybe stop here.
Okay, that's really interesting, Philippe, because that's exactly, I suppose, where my next question would be to all of you would be that this reset, if you like, or this moment in time where the mindsets have to adapt to the implementation phase. It's now, yes. But if you look at the issues that you've just raised there's the gender dimension, which clearly is, an overwhelming issue which needs to be tackled within this sector, not only in this sector, but clearly in this sector importantly. And then we talk about the informal and the formal aspect, which needs to be tackled, and all the issues related to that. And then you've just raised there the issue of essentially the working conditions of the people in this sector, how to make that sector more attractive. I think, Philippe, that's what you were saying, is how do you put in place a context that makes that sector something which is attractive, which attracts and maintains workers by improving the working conditions, their qualifications, aspects that they can see them having a career trajectory in the longer term. So if you look at those three kind of dimensions that you've all brought to the table here, and we look now at the context, it's changed with the pandemic. Carers were very much in the spotlight, essential workers, we were all talking about carers and the need for carers. But then we now moved into a new phase where we have, the Russian invasion in Ukraine, and we see the onset of energy prices, cost of living increases, refugees, etc. Is this care strategy fit to tackle these new dimensions? Are we in a position to respond to that, or are there things that we should prioritize in the new context? Maybe I'll go back to you, Philippe, immediately on that, and then go back to the rest of you.
Well, maybe I'll start with the working conditions. So we have quite an extensive dialogue with representatives of care workers who really voice the fact that they're overburdened and that they would like to properly do their jobs. And there have actually been strikes of care workers who essentially said we're not striking that much for ourselves. We are striking actually for the people we care for, because we think that they are in not very dignifying conditions, and we contribute to that, and we refuse to contribute to a system which is essentially paralyzing people, or worse. So there, I really think that looking at obviously there's issues with pay that need to be addressed by social dialogue, but that's not really for us to say. But if you take the person in need for care seriously, if you have her actively participating in decisions and designing herself the care path that she wants to be in, the setting that she wants to be in, then you have a dialogue going with the carers, and that dialogue gives sense of purpose as well to the workers. So really changing the way of thinking from having an institution that cares for people around the person and what are the person's need, and individually designing this has a potential to keep workers more bound to the sector and seeing that they're doing something not only useful but also something which is valued. Now, you touched on the different crises that we're facing. I would like to disentangle this a little bit. Obviously, there will be issues with informal care, with a lot of older Ukrainians who enter, or actually not only older Ukrainians, but a lot of Ukrainians who entered the EU and who are maybe stepping into these jobs, formal or informal, or sometimes in the gray economy, that are just needed because the needs are there. So there will be sort of a Ukrainization, I would say, of the sector in a certain way. But also something that we should not forget is that we have a very aging member state who is not member state, not yet accession state, who is at war, and all the implications this has for older people over there, and especially people in need for care over there. And I don't feel that we're actually having a conversation on the specific situation there. There's attention, probably not enough, though. There's some attention on children, on women in conflict situation, but there's very little attention on older persons in conflict situation. And this is an opportunity to change that and have older persons part of humanitarian protocols, for example. And this is something that we're missing in the care strategy. There's no international dimension. So even outside the Ukraine crisis, there's no international dimension about neighborhood policy, about accession policy, because care is a global problem. Issue, yes. The importance of care is growing on the global scale, not only in the EU. And the EU can shine with some good examples, and the EU can foster the development of good examples, and can be inspired by other examples elsewhere as well. Very directly, care services are also facing very high energy costs, which are rising. And there needs to be a particular policy attention to avoid rolling over these energy costs together with higher salary costs in some member states, because after the pandemic, some salaries have been revalued. It must be avoided that it's rolled over to the persons in need for care, because they are already 60% of them who are at risk of poverty. So they are not able to pay more. And so this really also needs to be in center of attention.
Thank you, Philippe. And Stacey, maybe you want to move on a little bit on that, perhaps particularly with respect to the informal, formal.
Yes, but I'll try to, I guess, follow the same structure and build on what Philippe said, if I may. In terms of the working conditions, again, as I said, we consider, just like the Commission, that professional care should be the backbone of universal access to long-term care in Europe. So, and yet the care sector is facing many shortages as it stands for reasons relating to poor working conditions, inadequate training, low pay. I think I read recently that over 70% of the long-term care professionals are low-skilled personal care workers. So clearly, there's a lot of investment that could be, made in the sector. And I think, again, the strategy also recognizes the economic potential offered by the care sector. So that's the first piece of the puzzle, really the central piece of the puzzle, and that's included in the strategy. There's an additional dimension which is not really mentioned in the strategy, and it relates to the potential offered by ICT-based solutions. And often when we discuss the future of care and potential offered by ICT solutions, it's always about the potential, but there's always some risks. There are some risks attached to the use of ICT. And here I'm thinking about the Uberization, so-called Uberization of long-term care. We are already seeing in many countries how people, are able to access long-term care services online because nurses, have decided to work independently, because then they can decide when and where they want to work. But the trade-off is obviously their social protection is decreasing as well. So clearly there's a connected challenge which is not captured by the strategy as it stands, and could also lead to another type of crisis related to care and caring in Europe. The pandemic, the way we see it, quite frankly, I'm not quite sure we would have a new care strategy without a pandemic. So paradoxically, I think the pandemic has been a trigger, a wake-up call, and in a way, arguably a positive thing in terms of changing the mindset of policymakers who suddenly decided, okay, we need to do something about care and caring. And then, the war in Ukraine, building on what Philippe said again, we are trying to establish contacts, and we have managed to establish some contacts with colleagues from the country. We don't have members in Ukraine at the moment, but clearly we see, a brain drain of people who would have migrated already to other countries, may stay there, for the rest of their life, maybe. older people, but also people who may enter the domestic care sector. Everything it means in terms of gain of social protection, working conditions, and the need to keep an eye on the fact that many household and many informal carers tend to, out of alternatives options, tend to hire themselves maybe on the gray or black market, domestic care workers, and probably Ukrainian migrants may be subject to that phenomenon as well. Sorry.
Yeah, thank you, Stacey. I mean, Hans, we talked about this briefly in the podcast, actually, about what Stacey has just been referencing there. But I think maybe also to ask you, do you see particular priorities that are within the care strategies that exist already, that we should prioritize in the current context?
Yes, so I'm really glad that the issue of care workers hired directly by the households came up. There are different ways to regulate that, and there unfortunately are also countries where there's no regulation at all of that. Now, it's interesting to look at the past. For instance, in Denmark, there was also were risks of this domestic care emerging decades ago, which is a very unregulated sector because it's really hard to control the working environment, and in particular when it's undeclared. But there are now countries where actually until recently this domestic care, so households employing a carer, was rather uncommon, but people are becoming richer. So most of the post-communist countries in Europe and more people in these aging countries need this care. There is very little long-term care available, very little publicly funded regulated care. So automatically there's a risk that this gap will be filled with care workers hired by the households. And now there's this massive influx of Ukrainian, mainly women, who indeed are at risk of filling this gap with large challenges for their working conditions and large challenges for the quality of care as well. Now, in relation to, it's good that the care strategy calls upon ratification of the ILO, International Labour Organization's domestic care convention, but it's not enough. Like you can you subscribe to that, but there are countries where you have this problem, even though they subscribe to it. So there really needs to be done something, and there are good examples in Europe. Well, Denmark, for instance, if you give good access to home care and in a publicly regulated way to approved providers, then there's no need for this type of employment. Also, Austria regulated it in a different way, and Italy used the COVID pandemic support. It made it conditional for care workers if they would be regularized. So different ways to do that. Now, that was not the only crisis you mentioned in terms of the energy crisis. Well, both for, actually, it was already mentioned that long-term care, former long-term care workers have very low pay. Many of them, we met this in a recent report on the long-term care workforce. Many of them earn very little or at the minimum wage. So if a little above or at the minimum wage. So for them, of course, it's a big issue when cost of living increases. So indeed, that's highly relevant. Yes, there are other working conditions challenges. I would emphasize always you have the specific physical challenges, like the lifting of people, but also the mental challenges. There's huge emotional strain, so more attention needs to go to that in a growing sector, and again, female dominated, so it has a gender dimension. And lastly, also for the recipients of care, or the people in need of care, the current energy crisis causes, first of all, that there's less money left for care, because unfortunately in many countries it's if you want good care at home in particular, it's still dependent on if you can afford it. And second, housing conditions. If people are not able to heat appropriately their homes, that has impact on health. Older people may end up in the hospital earlier, may be need of more long-term care, paradoxically. So that's
Yeah, well, actually, as you're speaking, and as several of you, I mean, you're answering some of the questions, and there's a lot of questions that are coming in from the audience, and thank you very much for joining us on the chat. I mean, question from Becky, Hans, you've to a large degree, you've responded to that, and others. Does the EU care strategy go far enough to ensure that carers have a decent standard of living and do not live in poverty amid the cost of living crisis? And I mean, the answer, you've sort of given some indication that it's difficult to kind of fully address that. It's not a yes or no question to some degree, and a yes or no answer to some degree, but clearly there are challenges at this particular time in that area. The other question, there are two questions here from Stephanie, and here it's about the member state implementation. How can the strategy have a concrete impact in the member states without any legislative activity or action included? I think care reforms depend a lot on financial investments that are decided on at national level. And the follow-up question to that is, so therefore, really, what is the added benefit to have this strategy at an EU level? And maybe there, can I ask you, Stacey, maybe to make a comment there?
Sure, I'll try to answer actually all of the questions, also the one about poverty, if I may. When it comes to informal carers and poverty, and does the strategy go far enough? I'd say yes and no. Because yes, because actually the strategy does include the need or a call on member states to, for example, develop financial support for informal carers, but only informal carers of working age. And we think that's a mistake. We think that's a disappointment, because obviously there are older carers. And there are also young carers, by the way, who are completely invisible at this stage. And all of these carers also need support. And so, so to some extent, it does capture the question of financial support, but not enough in our opinion. In terms of why we need an EU strategy, well, first of all of the challenges relating to long-term care, the growing demand, the growing prevalence of age-related diseases, the declining supply, the quality sustainability challenges are all common across member states. So it makes sense to actually at least coordinate or exchange and learn from each other. I should add that, as we know, many people from southern countries, young people from southern countries, will move up north to study, and many older people from northern countries at some point in their life may want to go down south and spend their retirement there. So people move around across Europe. And so it's important also to have an EU dimension on long-term care rights, because we need to discuss the portability of these rights. So that's why I think, it makes sense to discuss all of that at EU level.
Okay, and maybe a question then, Philippe, to you about that. It's related in part. I mean, the question from Lou is, what could be the role of European social dialogue in the care sector? Would the social partners be able to address some of these issues, but particularly here the issue of informal care?
I'm not quite sure about informal care because they are, by definition, they are not workers, unless it means paid care in an informal employment relationship. So people who are living with other people or providing care on the black market. So here definitely there should be a social dialogue looking at formalizing these relationships, providing those carers with social protection. By the way, that's also an omission on informal carers. There's only talk about income support, which is sort of, in my understanding, it would be money that you receive because you're providing care right now. But we have a huge and very gendered problem of the gender pension gap. And there have been several council conclusions already where member states agreed that there's something needed, such as pension credits for informal care. So this includes parental leaves, maternity leave, but also carers leave and other types of family leave. And member states have been calling for that. So now would have been the chance to actually codify this in a recommendation, which is stronger than council conclusions. But this has not been mentioned here. So, I mean, you can interpret this social protection into income support, but it's a matter of interpretation. So, yeah, social dialogue, definitely there needs to be a strengthening. And some of the scandals that I referred to have been linked to very weak or broken social dialogue within care providers. There have been cases in the most known ones is in France, but also in Germany, where care providers are accused of sort of breaking social dialogue within their organization, so that they can reduce costs and that they can create more profit. So strengthening the social dialogue will have a positive impact here. And I do believe that formal carers who are more satisfied with their working conditions also provide better care. That sort of goes without saying. One thing that should be part of, let's say, working conditions, social dialogue is training. And here I want to really emphasize the importance of prevention training of against abuse and neglect. Because that is an issue where sometimes, because we're all sort of compartmentalized, we're like either specialists on physiotherapy or on ergotherapy, or we're doctors, or we're nurses, or we're social assistants. So we all have these little hats where we look like that. And cases of abuse imply that you're open to what's happening in the wider care context and not only in what you are doing in your interactions with the person. And so there really needs to be awareness and more emphasis on that. And while social dialogue can be a way to strengthen training and skills, especially when it's informal or work carers in the gray economy, and then also prevention. I want to mention something because there's a question on the Barcelona targets. So I
was just going to go into that.
How the EU can support childcare, but just to have a little bit of talk on the two legs of the care strategy. It's interesting that one part of the strategy concerns childcare, the other part is concerning long-term care. It is presented as if it was a lifespan approach because it starts from the cradle to grave in a certain way, but it's not linked up. And I was talking about quality of life in care, and it's important to have a sense of purpose. And there could have been like the chance to at least talk about exchange of practices where persons in need for care or persons who are in residential settings can take a role in childcare. Not necessarily, the more heavy tasks of childcare maybe, but older persons going into childcare facilities to read stories. That's something that everyone can do. I mean, that's just an example, and it's definitely not for an EU text to prescribe that this has to be the case, because otherwise we would say that the EU is already again legislating the curve of cucumbers. But there can be encouragement towards those practices, and this has not been introduced. And this is something that I'm regretting, but it is still a chance to do it because the implementation of all this is in the hands of the member states. And so it's really about member states having to see this as an opportunity to learn from each other, to improve their own practices, and also to improve Yeah.
Yeah. I mean, Loren's question there was about the Barcelona targets, and you know, do we know how concretely the EU will respond, or how concretely it's going to support these countries which did not meet the previous targets? And I'm not sure if any of you has a particular answer to that. I'm not sure anyone here is really particularly well placed, but it's certainly an issue in terms of the implementation issues that we discussed earlier, and that there needs to be monitoring and measuring of that on an ongoing basis. And I assume that will be the same for this question. There's a follow-up question also from Mary, who asks, should domestic carers, domiciliary support workers be subject to the same regulatory requirements, i.e. minimum educational qualifications? Would you like to take that, Stacey? Do you?
Yeah, I can try at least. Yeah, I would say definitely, because you know, it's also related to the working conditions and the pay. You know, it really depends on if we want good quality long-term care. You know, we need well-trained long-term carers. I mean, that's as easy, you know, as that.
Yeah.
And yet, as I said, 70% of all long-term care professionals, as it stands, sorry. You know, have a very low degree of education in the sector.
Sure.
So yeah, we need to enhance also the qualifications of care workers.
And I think that's particularly important now, because clearly next year will be the European Year of Skills, where the focus will be very much on profiling and promoting educational training and skills in all areas, but not least in the care sector, where the strategy has just come onto the table. And I think that probably dovetails nicely with the question that you raised earlier, Philippe. You mentioned the quality of life aspects which are related to care. And then, of course, there are other, you know, quality of work aspects related to care also that we've talked about. And Hans, what I'd like you to maybe come to the table with is just a couple of ideas also of what kind of initiatives or issues could we focus on that would be perhaps outside the remit of the core strategy as it stands, but that could have a really positive impact on care and the issues related to care?
Yeah, so I think, of course, when you write a care strategy, the focus is on care, but actually, well, the care strategy does very appropriately mention prevention. However, when member states would implement it, it could be good to try to avoid a narrow perspective on care in terms of prevention, because prevention really comes from providing good working and living conditions across the life course. So by having healthy homes, healthy local areas, healthy work, that contributes to preventing and postponing care needs. Also, people with the same health problems may not, or disabilities may not need support if their local environment is designed in a way that they can both physically but also socially, that they can move around without any problem themselves. So there's a lot that can be done in other domains, such as housing, local area, but to facilitate independent living.
Yeah, housing, the urban environment, I suppose, issues related to, as we discussed, mental health. So things that are really reflecting on a sustainable life course approach to this, which has positive ramifications in the care sector that perhaps is not necessarily obvious at first sight. So it really is a very holistic approach to this. And I think that's a good way of us dovetailing into your kind of final takeaways. We're coming into the last 8 or 9 minutes of the webinar. And perhaps I could come to you, Philippe, if you had a key takeaway based on our discussion today related to the, what could be done to make the European care strategy work, what would that be?
Well, my key takeaway is that the text is very fluffy. You can interpret it in several ways, and it's up to every single member state to put the ambition in that it finds suitable. And there's a real risk of member states. Usually member states don't like to adapt. So they would just do the minimum and say that they have done their requirement for the EU level. But we should really advocate also on the national levels to turn that around and to say, this is an opportunity to refocus care systems, to repair care systems, to build care systems, and to make them more just, and to actually work on them so that they are fair to everybody. Because in the end, 1 in 5 of us will need long-term care at the end of our lives. That's just a statistical truth. So we're doing that, of course, for people in need for care today and for care workers today and informal carers today. But we're also doing this for ourselves in the future. And if we don't build the right institutions, if we don't invest into this right now, then they will not come by miracle. So this has been an overdue problem. The COVID pandemic has laid bare the huge shortcomings that exist in long-term care. And if we let the opportunity of the pandemic pass without action, then I don't know what needs to happen so that we can actually build a dignifying approach on long-term care.
And of course, you refer there to long-term care, but every one of us has childcare, whether it's our own care when we were children, or whether it's our children's childcare, or others with disability will face other care needs. And of course, even if we ourselves don't have long-term care needs, we will know someone who does have, or we will be providing informal care or formal care to those older people. So it is something that definitely affects us all. And I think that's a very good point to make. Can I move then to you, Stacey? What would be your key takeaway?
Sure. My key takeaway is that I don't think we expected the strategy to actually define exactly what member states should put in place to address all of the many questions we just or some of the many questions we discussed this afternoon. I think the ambition of the strategy was to give a direction, to ensure that all member states would move towards the same direction. And obviously, probably we need more than that. But as far as the role of the institutions is concerned, and what the Commission can do in the sector, let's face it, I think that's the Commission did a pretty good job in listing all of the right boxes. And again, coming back to my very first points, the fact that both formal and informal care are now captured as two issues that go hand in hand. That's a major step forward from our perspective. I think you mentioned earlier, Mary, that the next step is implementation. Not quite. In between, we still need to ensure that member states approve the strategy, as submitted. And I think the key challenge in the short run for all of us, and particularly for NGOs, is to encourage, let's say, member states to endorse the strategy without watering it down, at least not too much. And then after that, we can move to implementation and accompany the process indeed.
Sure. No, absolutely. You're absolutely correct. The one thing I would hear from what you're saying there, though, is that this interdependency of the different initiatives has really come to the fore in the debate today. And the discussion is that it's not just about the care strategy and whether that gets approval and that gets implemented. It's about the whole pillar of social rights and how we actually manage to move forward on so many different aspects of that, which also will have a positive impact on the issues that we've discussed today,